Welcome to Congressman Brindisi's July Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. Thank you for joining us this evening for an informative discussion with the Congressman and tonight's panel of guests with question and answer between the audience and the panel at the end. In addition to hearing from the Congressman, we've got representatives from the IRS, an Economic Development Agency, and a county executive on the line to answer your questions. We're going to be starting the call shortly, but we'll let folks continue to dial in for a few more minutes. When we get to question and answer session, if you've got a question, in order to ask it, you'll need to press *3 to join the queue. For folks just joining us, welcome to Congressman Brindisi's July Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. In addition to hearing from the Congressman, we've got representatives from the IRS, an Economic Development Agency, and a county executive on the line to answer your question. In order to ask a question during the Q&A at the end, please press *3. That's *3 to ask a question. Now, we do anticipate receiving a lot of questions this evening, and we're going to do our best to get through as many of them as possible. But if you don't get to ask your question, please hold on the line to leave a message so we can get back to you. We'll get started in just a bit. Just want to remind everybody that the way to ask a question, when or if you have one, is to press *3. That's *3 to ask a question. All right. I think we've got a bunch of folks that have joined on, so I'm going to turn it over to the Congressman for some opening remarks. Anthony?
Thanks, Sarah, and thank you all for joining the call today and taking time out of your evenings to join me as we continue to fight back against the global pandemic and do our best to safely and responsibly reopen our economy here in upstate New York. It's important more than ever that we hold events like this. Although we can't be in person, town halls, I think, are an excellent opportunity for people to be able to ask questions and get answers to some of the things that are on their mind. Since COVID-19 first came to our shores, I've held numerous telephone town halls, Zoom meetings, and conference calls with local workers, families, small businesses, and government officials. This dark time in our nation's history has highlighted the remarkable spirit, tenacity, and friendship of people in our region. It's been amazing to watch our communities work together. We've seen people making masks for each other, businesses offering their supply chain to help secure PPE, people delivering food to our heroes like our first responders and doctors, our essential workers, sacrificing to keep our communities safe, and even sometimes Democrats and Republicans working together to secure resources for our community. We need to continue to build on that, and in that spirit of togetherness, make sure we continue our comeback. As your representative in Congress, I've worked with everyone from the president to our local officials to our local hospitals and chambers of commerce to get us the resources and the help that we need. But we're not out of the woods yet. We know that, and that's why it remains critically important that we follow CDC guidelines, state and local guidelines, to do our best to contain this virus. That means washing your hands, staying home if you feel sick, and wearing a mask when you go out in public. Take it from the experts. A mask not only protects you, but it protects everyone around you. And the coronavirus has not been the only thing that has tested our community's resolve in the recent months. The uncertainty and unrest across our country has been unsettling, but here at home, I've seen our strength as a community again and again. In Congress, I've been working to deliver results for upstate New York, including passing bipartisan infrastructure legislation that will rebuild our roads and bridges, invest in our rural broadband, and hold big cable companies accountable for their shady business practices. And during the global pandemic, fighting to protect access to health care has become even more important. That's why I will always fight to keep protections for folks with pre-existing conditions like heart disease or diabetes, stand up to big insurance companies and drug companies, and work with both parties to try and fix our broken healthcare system. Last week, the House passed critical legislation to do just that, and I'm calling on the Senate to act. As Congress continues its important work, I continue to meet with folks across our district, and I want to thank you all for joining me tonight for this live telephone town hall. I'm honored to be joined on the call by a few local experts to help answer your questions. Tonight we're joined by three guests. We're joined by Kevin McKeon from the IRS and Stacey Duncan, who is the Executive Director of the agency, or the Broome County IDA, and County Executive Anthony Presenti from Oneida County. With that, I'm going to let our guests say a few words, and then we can get right to your questions. So let me start with Kevin from the IRS. If you're willing to say a few words, the mic is yours.
And just a friendly reminder, you might have to unmute yourself.
I guess that would help. Sorry about that. Thank you very much, Congressman Brindisi, for inviting me back on one of your town halls. We're very much engaged at the IRS, is implementing the COVID relief legislation and providing as much help as we can, as soon as we can, for taxpayers. And in terms of the economic impact payments or the stimulus checks, we were able to get those out very quickly. As of June, we'd already paid out $159 million economic impact payments. There's still some folks out there, though, who have not gotten their stimulus checks, and these are probably low-income Americans who usually don't file tax returns. Those folks can register using the IRS non-filer tool that we created, and they can get a payment for their stimulus by October 15th. So we have an outreach campaign to reach folks like homeless and others who are not aware of the stimulus payments, but they do need to come and use that free non-filer tool that's available on irs.gov. Another thing that we want people, we work, of course, with Social Security, the VA, the Railroad Retirement Board to get these payments out quickly. There may be some folks who, the check was missing in the mail, that kind of thing, that still haven't gotten it, but we have a tool called the Get My Payment tool on irs.gov that gives them advice on how to get the check sent to them. And all the information is continually updated on irs.gov on our coronavirus tax relief. So I encourage people to go there to look for help. One other thing to mention is look out for scams related to economic impact payments. And people should watch out for scams using email, phone calls, or texts relating to the payments. Be careful and cautious. IRS will not send out unsolicited electronic communications. Go directly and safely to irs.gov for official information. Thanks again, Congressman Brindisi, for inviting me, and I'll happily take questions later.
Thanks, Kevin. And now I'm going to kick it over to Stacey Duncan, who is the Executive Director of the agency. And the agency is the lead economic development organization for Broome County. So they have really been deeply engaged in the reopening process and helping assist small businesses across the area as they reopen. So Stacey, I'll kick it over to you.
Thank you, Congressman, and thank you so much for the invite. Good evening, everyone. And I can't say enough about the support that we've received from Congressman Brindisi and his team from day one. And I say day one, not even, pre-COVID. The team's always been incredibly responsive, and the Congressman's always made himself available. And we saw such responsiveness during COVID. And for example, on that, we had a call very early in March when things were just moving so quickly. Myself and some staff were able to meet with his team and, they said, what do you think businesses need? And we said, right now, I think two things is they've got to maintain cash flow, because I don't know what other event other than this was such an immediate stress test on our local economy, from a position of cash flow for our large and especially our small businesses. And I think they truly understood that, and we've made the comments to them about, the stimulus and the programs for business need to continue. They can't be short-term, and they need to be flexible. And, not very long ago, the Congressman signed on to the Payroll Protection Flexibility Act, and that was in so many ways a godsend to a lot of small businesses here in our community. When this was happening and moving at such a fast pace, we polled about 1,000 businesses in and around the Broome County area and asked them, two questions: what's your biggest need right now, and what's your long-term need? And the immediate response was, of course, assistance with cash flow, with working capital. So I do think that the PPP program, without that, I'm not sure that we would have been able to keep so many businesses afloat. And I think the recognition that program needs to be agile and needed to allow for some more time for businesses to reopen, because I think we're finding the process may take longer than certainly we all can predict. That was incredibly helpful to us. The other greatest need was a source of information. Everyone was getting so flooded with information, and so we set up some online tools, a resiliency toolkit, and a reopen playbook. And we've tried to be incredibly responsive and providing digital formats for all of the information that businesses can have as they look to reopen. What we're finding, and I do participate in the Southern Tier Regional Control Room calls. We have daily calls with the state on the process of reopening. We know that the state is moving very cautiously on reopening in reaction to what's happening elsewhere. And so we know there's still a number of businesses that have not been open. So we're looking at pooling both local resources through some financing programs that we have to help them, carry on over these next couple of weeks and months, as well as the ability for the payroll protection to be extended to August was tremendously helpful to our business community. I think that as we look over the next few weeks and months, there's so many unknowns, but I think what we benefit from is this information share that we have with the Congressman's office, with our state officials and our local officials on, hearing directly from the businesses. Right now, I think the biggest concerns that we're hearing are the long-term supply chain. There are some concerns from businesses. How long can they sustain, a reduction in size, a reduction in capacity, some challenges with their supply chain of much-needed materials. And as well, the other side of that coin is the workforce development. If I looked today, I could tell you we still have actually hundreds of jobs available. They are all directly related to those sectors that are immediately responding to COVID. So you have frontline workers for food service, heavy tractor trailer drivers that are providing much-needed supplies. You have a number of jobs in the healthcare field. So we're focusing a lot of our time and effort on connecting people that may have lost employment with those much-needed essential work occupations. So we are focusing, we have a recovery task force that's focused now on what are these things that we need to build economic resiliency in the weeks and months ahead as we await guidance on will schools open, what does the next several months look like. So we, again, just want to continue to iterate that flow of working capital into our small businesses, anything we can do to continue to provide them the ability to stay open is much needed. And, again, we thank Congressman Brindisi and his team for all of their support on that. Thank you.
Thanks, Stacey. I appreciate that. And next, I want to introduce Oneida County Executive Anthony Pacenti. He's been a steady hand for all of us here in the community during the darkest days of coronavirus, giving daily briefings, and has been a real leader during the reopening process, making sure everything's done safely. So, County Executive, I'll turn it over to you.
Thank you, Congressman, and thanks to all who are joining us today, and thanks to Stacey and Kevin also for being a part of this call with us, and I want to thank you for your work. And Congressman, as we know and we talk about dealing with this virus and this pandemic, actually, I want to remind the Congressman, I'm sure he knows, but he came to me early on, actually it was in near the end of February as things were happening, and he hosted a meeting in my conference room on March the 6th, which seems like years ago, with our healthcare facilities, our hospitals, our schools, our not-for-profit agencies, and a great mix of the community to really talk about what at the time we didn't know how bad it was going to be and just how severe this crisis was going to impact us. But he worked with us from the very beginning. I want to thank him for that, and our continued work on many issues related not just to this crisis, but obviously before and even during this, as we looked at other areas that he has been helpful. So thanks to the Congressman for his leadership there. Oneida County obviously has been, really, I look at us also as being a leader. A lot of what has been done over the last few months in terms of what we've had to do and what we've put together as a community and as a county government has really made an impact, and I like to say in curbing what clearly has been something obviously no one's ever dealt with, and the numbers still are staggering even with that. Here in Oneida County, we've conducted over 53,000 tests, and we currently have only 238 active cases. We've resolved 1,349 cases that have been resolved. The tragedy of that has been we had lost 98 of our residents to this virus. But through that, we've led the way in terms of our hotlines, our helplines, reaching out, working 7 days a week. Our departments have been doing so since March the 13th, when I declared a state of emergency for Oneida County and dealing with this crisis, even before we had the first case of a positive case in Oneida County. And through that time, we have established, as I said, a hotline through our health department that has operated 7 days a week since that time and continues. We through holidays, we went through Easter and Mother's Day and Father's Day and now the 4th of July and Memorial Day, all of those. Our staff has worked around the clock in making sure that people get the information they need and the assistance they need. Helplines, so that people that were displaced from work and didn't have any place to go could get the assistance from the county. We've worked with our community agencies to establish a mental health hotline for those people who are suffering through other aspects of these quarantine and the isolation that goes along with this pandemic. And since that time, worked with our businesses, and I know Stacey talked about the agency working in the Southern Tier, and we've done much of the same up here, working with our businesses, working in collaboration with our manufacturers, establishing a line of communication, but also best practices, put guides on our website, created a dashboard for not just for our county, but for our entire Mohawk Valley region. So we've been very busy, as I know everybody has been, in dealing with this, in addition to continuing to seek to run a county and keep us afloat as we go through some difficult times. Stacey talked about the businesses and their struggles with cash flow, and for government, that's also a struggle as we continue to provide services. And I want to thank the Congressman. He's been a leader in terms of what the Congress has put forth, and I echo what he said in urging the Senate to pass another act that will provide assistance to local governments, in particular county governments who have been at the front line of this pandemic. There is much more to say, and we have been continuing to be in communication, and we want to continue to work together to see that we get all of the assistance we need to our residents, that we continue to fight and supply PPE to all of our first responders, our hospitals, and continue to fight this pandemic at every corner. I'm proud of what we've accomplished. Obviously, no one wants the restrictions that are in place, but Oneida County was the first to put a mask order in, which even was prior to the state's executive order in wearing masks in public places and that carried a fine. It wasn't something that we did in order to be punitive. It was something we did to save lives. That other aspects of our approach have been, in terms of dealing with the business community, setting up a collaborative purchasing piece for PPE so that they could get the lowest possible cost, so that we know that businesses were struggling, those that were allowed to open early on and those that have opened since then. We've spent hundreds of thousands of dollars to get the lowest possible price so that they could tag along with the county's purchase of PPE. So it's been things like that have worked, that we continue to strive to do. As I said, we have much more to do. I don't want to continue to go on and be able to answer any of your questions, but again, I want to thank the residents of our entire region, and in particular Oneida County that I represent proudly and have served with the congressman and also in his prior role in the assembly. I want to thank all of our residents who have done an outstanding job in this, and the business community that I know is struggling, and we are working to help, and of course the numerous people that are unemployed right now that we want to get back to work. So there's much more to be done, and we have a ways to go, obviously, with this virus, but I believe that we will come out of this stronger, and hopefully with all we continue to work together, we will see much brighter days coming before us. So again, I look forward to your questions, and thanks again for having me.
Thanks, County Executive. Sarah, I think we'll turn it back over to you for our first question.
All right, sounds great. And just a reminder for everyone who may have a question but not know how to ask it, just press *3 to ask a question. So our first question comes from Laura from Broome County. Laura, can you hear us?
Okay. Oh.
Laura?
I screwed up.
You got a question?
I'm sorry, I
Laura,
screwed
if you
up.
want to ask your question. That's okay.
Yes, I screwed up. Okay, the gentleman from IRS did not answer the question of direct deposit through Social Security, and none of us have gotten our checks. Yes.
Kevin, you want to take that direct deposit for Social Security?
Yeah. Okay, so what happened with Social Security is we got the information from 1099s and data from Social Security to make payments directly to Social Security recipients, and we used the payment method that the recipients had for their Social Security. So,
well, the thing is my husband got his. He's a 100% disabled Vietnam veteran and Social Security, and he got his the first week.
Okay, great.
And he doesn't file tax.
Okay.
He got it right through our regular bank account for our SSI checks.
Okay, so he did get the stimulus payments that way, correct?
He did. I didn't. And I'm on Social Security.
Okay, so there could be other reasons why yours was held up, possibly a tax filing obligation.
No.
But we do have a hotline number that is especially for economic impact payments,
Okay.
And so we encourage people to call that number and speak to an IRS assister. That number is 800-919-9835.
800-919.
9835.
Oh, okay.
And give that a try. And also our friends at the Congressman's office, they also send us inquiries about people who didn't get their check, and we help them directly
cool.
as well.
Okay, thank you very much, sir.
You're welcome.
Yep. And
Bye.
don't be afraid to reach out to our office too. We can work with our liaisons at IRS to answer questions.
Okay, thank you very much. Doing a good job.
Thanks.
Thank you.
All right, thank you very much, guys. We've got a question from Olive in Herkimer County. Olive, can you hear us?
Yes, hi, this is Olive. Can you hear me?
We can. You got a
Okay,
question?
great. All right, well, my question is this. I know right now everyone has been in reactive mode because it is an emergency, but given that this is a flu that could be very much like the Spanish flu that could last for years, the COVID right now is mutating, and we're globally, everyone's printing money like crazy. It's devaluing the value of our dollar. People are seeing food prices going up, and a lot of these small businesses that might have been struggling before this happened, now they're facing loans and working maybe at 25%. And I just think that I guess my question is, strategically, in 6 months to a year, you could be seeing, a lot of mortgage defaults. You could be seeing a lot of businesses that are never coming back. 20% of the population that was working, not having a job to go to. Our dollar being devalued because of the amount of money printing. So I know right now you're in reactive mode and you need to be in that, but I've wondered if there are any discussions strategically, if this thing lasts for 2 or 3 years, how we're going to survive as a nation, because if people can't afford food, if they can't afford their rent, if landlords can't pay their rent because their mortgage, because the tenants can't pay rent, you've got all these commercial landholders that, businesses going out and defaulting on their lease agreements. You're just going to have a waterfall of one thing after another collapsing. And we could be in for a depression worse than what happened, back in the 1920s. So I don't know if any conversations have happened how to deal with that. I think it's not just the U.S. I think it'll be a global event, because everybody's doing the same thing right now.
Right. Well, I can talk a little bit on the picture in terms of Washington and thinking strategically going forward, and maybe Stacey or the county executive maybe want to talk about some of the concerns county governments or small businesses may have going forward here, and how do we address them. But I would say strategically, the first thing in my mind, the most important thing is we have to get the public health crisis under control. Congress appropriated $3 billion for vaccine development. And really, we're not going to be out of the woods yet until a vaccine is developed that's going to help prevent this virus and stop the spread of this virus. So number one, we have to get the virus under control. That will allow small businesses to fully reopen. That will help us go about our daily lives. And the quicker we can do that and be safe and be smart, the sooner we can get to full reopening of our economy and get things back on track. I have also said that while we're in this economic crisis, this is actually the time when we should be spending to try and stimulate the economy by helping small businesses who are shut down with the PPP loans, by providing stimulus payments to folks, by helping with unemployment for people who are out of work. And although many businesses have reopened, what we're finding is that there are many businesses that are going to remain closed for a while, just because folks are perhaps not going to travel as much or do other things as they did before, and that's going to impact many businesses and many industries across the country. So we have to keep that in mind and be flexible going forward. In better times, when the economy is doing better, that's the time when we have to focus on debts and deficits. That's why last summer when the economy was doing better, I didn't support a budget because it raised the debt. And I think when we have good times, we have to look at how we start paying down debts and deficits and not just print our way out of these issues. So I think all the points you made are very good points. We have to look at this not just in the immediate term, but what we're doing long term to really help stabilize the economy, get people back to work, and be safe. And I don't know if Tony or Stacey, you want to add anything else from a more local perspective?
Yeah, thank you, Congressman. And I agree in that I think, and I certainly see the concern, and it is something we're looking at from a long-term point of view. But I think, when we look at this, we're still very much in a response mode. And we've looked at this sort of from three vantage points: response and recovery, and then ultimately resiliency, which I think all overlap. And what we found is, like I said earlier, without that ability for a company to meet their payroll and meet other obligations, which is why we strongly supported the Flexibility Act, because it also enabled those payments to provide for not only payroll, but also a higher percentage of your of a company's, monthly obligations, their rent and other obligations, which are keeping them, I think, whole, because we know the full ramp up is going to be slower than we anticipated. I think some of that too is the local communities being, we've seen this across the region, and I'm sure it's all over the Congressman's district, is a lot of support to encourage people to responsibly get back out into some routine that they have. We know that nobody's going to necessarily dive back into what they used to do, nor are we encouraging that. But we want to build consumer confidence as well, so you can still find new ways to support those local businesses, and if it's doing more things online with local businesses that have those platforms. Still a lot of ways we can achieve some economic recovery without totally overburdening the public health system. So when it comes to long term, it's a very valid point. I think we have to look at this from the perspective of what are the opportunities, because we know a lot of systems that we have are going to change dramatically. So we think there's a lot of opportunity for our manufacturing sector, and the Congressman's been incredibly supportive of that. We saw a lot of companies pivot and start to create new things, start to change the way that they do business to be more productive and efficient. So we think there's a great opportunity to do more reshoring of manufacturing processes and build a supply chain, especially with PPE, that'll protect us from a longer-term event. We think even with the service sector and professional services, a lot of us transition to this remote work life very quickly, but we think once we get into a new kind of way of working, there's always going to be those opportunities to build new economies, and I think that's one of the things we have is we're very innovative, right, in the United States. So I think we have to recognize that the systems of old aren't going to be returned to 100%. So how do we use this as an opportunity to strengthen things like distance learning and other ways to still have a healthy economy in different times? So, we're looking at all of that, and also how do we find ways to get investment at federal, state, and local dollars. We think all dollars need to come into communities to support existing and new businesses. So it's really a time of sort of reimagining and rediscovering ways to do sustainable economic development over the next couple of years.
Tony, did you have anything you wanted to add?
I could. I mean, obviously, you covered. I mean, both of them covered everything very well. I guess I would just amplify on Stacey's last point about the creativity aspect of it, but also in terms of working differently. I think it's an opportunity for us, especially in upstate New York, to again with all great respect to our our neighbors to the south and in the city and into the island. We know that people are and we saw this. I was around with state government at the time when 9/11 occurred, and things were changing in terms of the industry, and companies were spreading out a little bit more. We're seeing the ability of people to work from home, and that has been expanded more so this time than any before. Our goal, though, is to work on growing that, but at the same time solidifying our small business sector. And I think Stacey talked about the supply lines and the change, and obviously pharmaceuticals. Those are going to be the areas to go after as economic developers, look to rebuild the economy. Here in Oneida County, we have several projects on tap that are still ongoing. One of them is with a major semiconductor manufacturer that the congressman and I were instrumental in bringing here, as well as a brand new hospital for our downtown that will, again, spur local development and growth. It's up to us also on the government side to instill in people the issue of buying local, shopping local, and getting those businesses back and up and running. We've done things. Again, another place where we were a leader was in looking at increased capacity for our restaurants and during this time, in terms of outdoors, which is never really easy in upstate New York because of our different weather patterns, and doesn't work all the time. We have to be creative and find different ways in which our small businesses can compete, but also look at other ways in which our business sector can adjust to what is changing. And clearly, whether it's going to be another 6 months until a vaccine, or hopefully that's not that far away, that we can move towards at least some areas of normalcy. But we have to try and look at ways in which this economy can rebound, but we have to continue the investments we had in place beforehand, and that's ever so important now. And that's one of the areas I agree with the governor that we need to continue to build upon those things that we were so successful on early on, and that were really a part of the economic rebound of upstate. They're needed more now more than ever.
All right, thank you so much. Just a reminder for everyone, if you have a question, it's *3 to ask a question. So, speaking of, let's take another. We've got Colt from Barneveld.
Okay, be quiet, bud.
Can you hear us?
Yeah, can you guys hear me?
We can hear you. You got a question?
Okay, so I really appreciate the opportunity to ask questions. And for those of us who have transferred to primarily telework, I know that a lot of us probably really appreciate the Congressman's seemingly lifelong journey to expand cable access. So we appreciate your role as a cable guy. But at the other end of the risk spectrum, I have a lot of concerns about the folks in our community who are having to go to work and in person, and particularly those at the low end of the economic spectrum who, and particularly our local immigrant population, who really don't have the option to telework. And I think what we're seeing now with the rising cases in those populations is that there's a gap that we've missed that we need to fill in order to make sure that we aren't leaving them behind. So that's one. And then the other thing is, with this, I know we're thinking in a lot of cases, long term, but in the short term, we do have options besides vaccine and treatment, and that is test, trace, and isolate. And while Oneida County and New York State have done much better than most of the country, I still think we're probably still an order of magnitude short of where we need to be in terms of testing capacity. So I'm curious with County Executive Picenti at the local level, and also Congressman Brindisi at the federal level, of what can we do to really get this testing capacity ramped up. We're months too late to the game, but in terms of as a national response. But what can we do to get that testing going now? Thank you. And sorry for the long question.
No, that's good questions, Cole. You touched on a number of very important areas. I'll talk a little bit about the infrastructure and the broadband piece first, and then talk a little bit about telework and testing and tracing and isolating. On the infrastructure piece, I hope I'm alive to see when we finally can connect everyone in this country to high-speed internet access and cell phone coverage, because the divide between urban areas and more rural areas was on full display during coronavirus, as people were trying to conduct distance learning. And if you're in a school district that doesn't have access to high-speed internet, or the broadband doesn't work where you live, you don't have access, it's almost impossible. And we heard stories about teachers having to bring homework packets out to homes, and schools purchasing Wi-Fi hotspots, doing whatever they can to conduct distance learning. Same thing with teleworking. For folks who were able to telework, if you live in an area that doesn't have access to cell phone coverage or high-speed internet, it's almost impossible. So the infrastructure bill that we passed actually last week provided more funding for broadband, but it also took a couple pieces of legislation that I introduced to deal with big cable companies like Spectrum. One was to create an office of internet connectivity to make sure that money that actually is being spent by the federal government to expand broadband in underserved areas is in fact being utilized to help people who are not connected right now. We don't want to see companies taking advantage of state or federal dollars and then not using that money, like a particular cable company here in New York did, to not expand their service. So this would provide more oversight over companies. And another piece of the legislation that made it into the infrastructure package would have more transparency around these cable companies. So when they advertise blazing fast internet speeds, that they actually deliver upon the promises that they're making. Teleworking, you're right. Not everyone across the economic spectrum is able to telework, and especially folks who are in the lower income brackets. And that's why it's so important that as we move forward here, one, we acknowledge the hard work that many people have done, whether it's our essential workers, our frontline workers during the height of the coronavirus, and acknowledge that work through hazard pay, but also going forward, making sure that they have access and the employers are providing PPE and there are strong safety guidelines in place to protect people who are working who don't have that ability to telework. And then finally, on the testing, tracing, and isolating, I've been very disappointed in the federal response to that. The HEROES Act, the state and local money that was in that I supported, and we're waiting for the Senate to act upon, would be very helpful for local contact tracing, and we'll find other numbers on testing as well. There are $75 billion in grants to state and local governments, as well as health departments, to support testing, contact tracing, and isolation or quarantine that was in the HEROES Act. It doesn't seem like the Senate wants to take that up, and we've had to force the administration through legislation to create a national testing strategy, which they still are not really doing. So much more has to be done on the federal level in that regard. And County Executive, you could talk more at the local level.
Sure. Again, the issues of first of all taking off where the congressman left off. I'll go with testing because obviously I've been a big, that's been a big hallmark of our, at least our success, to a great degree in terms of where we've seen numbers and where we've been able to track and really focus on the areas that need it. I have been pushing the state, and some of this is again, and it's not passing the buck. It's just a matter of dealing with the regulatory bureaucracies that even those of us in government have to deal with, and from within, as well as when the public and business have to deal with from outside. So we've been expanding our testing capacity, and we want to continue to do that, and have been working with the state, but with also places like Rite Aid, which we established. They only had one of 7 test sites really on the entire East Coast that Rite Aid was doing, and they did one. I got them to do one here in Oneida County, and we got the Griffiths test site, which is run by the state. We did another one this past weekend here downtown Utica, and we're in the process of setting a couple more up in the neighborhoods. One of the issues with that is, the testing has to be overseen by, the approved health agency, and in that regard, a hospital, with licensing, and so with the shortage and the great demand on our healthcare workers, that's been a little bit of the struggle in terms of setting up more remote testing areas for our residents. In particular, dealing with our immigrant population, which the Congressman knows so very well, and I have in working with them over the years. Obviously, the communication issue is one that we work very closely with the center, which deals with our refugee and our immigrant population very well in terms of communicating and getting that information out and setting up those testing even at the center. We did that about a week or so ago as well. We need to continue to do that and to get into the inner cities where the testing needs to be done, and that's a priority of ours. More testing, obviously, when you see that, when we see double-digit numbers come out of tests, and in the last couple of days we've been a little bit lower, but I know people think that, wow, that's a lot of cases, but it's really because our testing is multiplied from the early days of doing 200 to now doing about 1,200, and in some days even more. We are, that's a great way for us to identify and, in terms of our dashboard, really break down the demographics of where these cases are. So we'll continue to do that and continue to push for that. In terms of the workforce, again, I talked about the remote work and that, but even having said that, the issue of frontline workers, of essential workers, and I'm not really fond of that term because I really believe everybody's essential in what they do. Although I know that that's become the catchphrase during this pandemic for people that have been working all along. The issue of not everybody. You're right. Not everybody will be able to work from home or telework, and that's because not everybody will. I mean, there's not all of those jobs can be done from home. I mean, obviously, county government, we started out and we had many of our staff working from home, but we're a service provider as well, and we need people on the ground servicing our residents. So we're not unlike many other businesses that really need to get back and remove the aspect of people working from home and getting them back into the workforce on a daily basis, and out literally on the ground. And so when you look at many industries, they're not going to be able to do that, and then there is going to be still that demand, and we are still going to be a community, a state, a nation that requires people that work at their place of business and not all from home. That's going to be really limited to various industry sectors. So the more we can do enough testing even at those sites and even at work sites, and really work with our businesses to keep people apart as best we can as we go through this, and then with the proper PPE, we can address the workforce side going forward. And I think I don't know if I missed one other point of that. So
I think you got it. Thank you so much. All right, we've got a question from Teresa in Broome County. Teresa, can you hear us?
Yes, I can.
All right. You've got a question?
Yes. Hang on just a minute. I have to get back to my notes. My question was for Mr. McKeon. I've heard and read conflicting statements about the economic stimulus payments being taxable or not. That's my question. Are they or aren't they? And my second question is, do the economic stimulus payments have any effect on Social Security income level caps. I normally work through the summer, but because there's no school, I'm not working, so I'm collecting unemployment. But instead of the 6 weeks, I'm thinking of only taking the 3 weeks because I don't know if those payments will have an adverse effect on my Social Security income. If I take the whole 6 weeks, I'll be over my cap.
Teresa, this is Kevin, and thank you very much for the question, or the two questions. Question number one, are they taxable? No, they're not. Do they have any impact on Social Security? I'm not aware that they would.
And, we can always, if you call our office, we can always do an inquiry on your behalf, anyone's behalf, with questions like this. So just if you call 315-732-0713 and leave a message, we can get you our casework form and we can specifically ask that question on your behalf just to make sure. All right, let's take another question. We've got one from Beth in Appalachian. Beth, can you hear us?
Yes, hello. Thank you, Congressman, for the town halls that you've been doing and for all of the hard work that you put in during these difficult times. I appreciate the communication. And my question is, you referenced in your opening remarks that Congress had just passed a bill to protect pre-existing conditions and to enhance access to health care during this crisis. I was wondering if you could elaborate more on that.
Sure. Thank you, Beth. So last week, the House passed what's known as the Patient Protection and Affordable Care Enhancement Act. I supported it. I think that this is a time where we should be expanding health care, making it more affordable for individuals across the country, especially during a global pandemic. This is a time when we should not be trying to take away health care from people. And the bill essentially does three things. One, it lowers Americans' health coverage costs. It does that by expanding tax credits to lower Americans' marketplace health insurance premiums and allow more middle-class individuals and families to qualify for subsidies. So for the first time under this legislation, no person will pay more than 8.5% of their income on a silver plan in the marketplace. So what does that mean? So a family of four earning $40,000 per year would save nearly $1,600 in premiums each year. Someone who is 64 years old, earning $57,420, for example, would save more than $8,700 in premiums each year. That's one big piece of the bill. Question might be, how do you pay for that? Well, that's the second part of the bill, by allowing Medicare to negotiate lower prescription drug prices. Right now, Medicare's hands are tied. They can't negotiate drug prices with drug companies. But as part of this bill, we included the Lower Drug Costs Now Act, which is a bill that we had passed previously in the House, which delivers immense savings to taxpayers, employers, workers, and patients by preventing Americans from having to pay so much more for our medicines than pharmaceutical companies charge for the same drug overseas. By allowing Medicare to negotiate drug prices, we'll save billions of dollars at the federal level, which can be used to help lower health insurance costs for everybody. And then finally, what it does is it cracks down on junk plans and it strengthens protections for people with pre-existing conditions. It would reverse the Trump administration's expansion of junk health insurance plans that do not provide coverage for essential medical treatments and drugs, and it allows companies again to discriminate, these insurance plans to discriminate against people with pre-existing medical conditions. We're all just one diagnosis away from a pre-existing condition, and no one should have to worry about getting health insurance coverage because perhaps they have asthma or heart disease or had cancer or another condition. And we hope the Senate passes this bill quick.
All right, thank you so much. I have just noticed that time has flown, so I think this is going to be the last question, but if you haven't had an opportunity to ask your question, please stay on the line and leave a message at the end. But before we race ahead, we've got a question from Ernest in Broome County. Ernest, can you hear us?
Hello.
Hi, you've got a question.
Yes, I'm 81 years old, as I mentioned, and I have an immune problem. So I haven't been out to any stores since January, February. Recently went out with a partial opening. I visited 3 places of business: auto parts, tractor parts, and grocery. Auto parts workers and customers both not wearing masks, even though they had a sign on the door. Tractor parts workers not wearing a mask, although behind plexiglass shield, but they came out to service me anyway. And customers not wearing masks. Grocery store, every worker wearing a mask, a few customers without. All had signs on the door: wear a mask, stay behind the line, so forth. So my question is, could the county health departments go out and at least do a visit and remind some of these businesses of what the mask and social distancing is for? It's to protect other people. You're wearing a mask to protect other people and respecting other people's health. So that was one question. The other was maybe Congressman Brindisi you could do something with one of your ads reminding people about the importance of it. Even though you're running up against shoveling sand against the tide with Trump out there, I think it might be helpful. The other thing, I listening to the lady from Appalachian, a thought occurred to me. Got to stress the importance of selecting senators, although we have 2 already. The other states, if you don't get the Senate change and get McConnell off of his seat, I don't think many of your bills are going to make it through Congress. I don't know what you think. Maybe you could expand on that. So, thank you.
Sure. No, I appreciate the question. I'll just say quickly, there's a lot of bills that I wish McConnell would move on. One would be the prescription drug bill that would save a lot of money for everybody and the federal government. The health care bill, another one, an infrastructure bill, another one. These are all things that are going to help our economy and help workers and families across the country. I definitely will do my best, and I think all elected officials really should do their best to continue to reiterate the importance of wearing a mask during this time period. I know the county executive can talk a little bit about what counties can do, but I think it's important, and I wish the president would reiterate this as well. And it is kind of like swimming upstream sometimes on this issue, but it has been shown that these masks, although inconvenient, are really helpful in helping to prevent the spread of this virus. And we're seeing what's happening in other states right now that did not take some of the proper precautions, did not reopen their economy a little too early, and now we're seeing big spikes in places like Florida and Texas. And that's going to put a strain on the public health system. It's going to put a strain on the hospitals and the number of ICU beds that are available. If folks are not wearing a mask, if businesses are not enforcing it, you can file an anonymous complaint with the New York State Department of Labor. And maybe county executive, you could talk a little bit about what can counties do on that point.
Sure, Congressman. I know speaking again, I mentioned that we, Oneida County, and I know that Jason Gardner's done a great job down in Broome County, the county executive there. Our health department has, along with our sheriff's office and even my office, we handle, and there have been anonymous complaints. There have been complaints that have come in with that. People clearly put their name to them. We can you can easily notify businesses and tell them they're out of compliance. And one of the things I found most effective, obviously, was the very fact that we started a process early on of stating that we were going to be answering those complaints directly, either with a sheriff's deputy or one of our health department personnel to look in and see and give a warning and tell them if they did not comply, they would get fined, as we instituted that here in Oneida County under executive order. So the health department can, we continue to talk about it every day regarding masks, as the Congressman said. It's very important. We say it, every statement we make regarding this. It's still the best defense right now that we have, and it's important that all businesses comply. It's important that the businesses recognize that they're putting their employees at risk, and that's where employees do have to speak up as well and should be just as concerned about who comes in their establishments without it. And they do have a right under the state's executive order, and clearly if the county put one forth, the businesses do have a right to refuse. And one of the things that I've stressed to businesses from day one is, look at it this way. If someone walks into, whether it's that auto parts store or whether it's the Tractor Supply or whether it's the grocery store, if anybody today walks in with a cigarette, or cigar or a pipe or whatever, they're told immediately, you can't do that here. You have to leave. It's not allowed. And the same goes for a mask. Right now, masks are mandatory in those stores. So businesses can enforce it in that regard and treat it the same way they do as a patron that would come in with a cigarette and refuse entrance. Now, I know that businesses don't want to refuse customers, but they're putting their employees at risk. Clearly, they're putting their customers at risk and potentially losing more customers if they continue to do that. So there are many ways in which it can be done, and I know I'm speaking on behalf of my county, but I know other counties have done the same, and much more can be done under the governor's executive order.
Thank you so much. So with that, I'm going to turn it back to Anthony for some closing remarks. Anthony?
Well, thanks, Sarah, and I just want to take a second to again thank all of our guests who are on. Stacey Duncan, who's the Executive Director of the agency in Broome County, Kevin McKeon, who's our District Congressional Liaison at IRS, and Oneida County Executive Anthony Pacenti for all of their helpful information. And if you did not have a chance to ask a question tonight, but you want to still get that question answered, please stay on the line. There's going to be an opportunity for you to leave a message with our office. It could be a question, could be a concern, a statement, whatever you want to leave. Please go ahead and do that. And if there's something that we can help you with, a federal agency or other issue that you're having, we are here to help. That's what our caseworkers are here to do. I would just caution, please be patient. We have staff that is responding diligently to questions that are coming into our office, and sometimes it takes a day or so to be able to get back to folks, and we get a number of messages after these town hall meetings. So please leave your message, and I assure you someone from the office will get back to you and do what we can to assist you. Again, thank you to all of our participants. Please, everyone, stay safe, and hopefully we will get through this soon and be able to resume in-person town halls in the future. Thank you all so much, and have a great night.
Thank you.